Hello, Marcus Boston. Quick video tonight, and I want to talk with you about assessing a baby's well-being. And the reason why I want to talk with you about this is because in a lot of my videos, I talk about the injury HIE, or hypoxic ischemic encephalopathy. And a question that can come up with this discussion is, well, Marcus, if this is a situation in which there is a reduced level of blood and oxygen, then is there some type of way during the process that doctors and nurses and medical professionals that they can assess essentially what we're talking about, which is fetal well-being? And there are tools that doctors and nurses that they can use to be able to assess fetal well-being, and there's a couple of them. And first of all, there's ultrasound technology is something that can be used. Doppler, these things can be used to help assess fetal well-being. In addition to that, the electronic fetal heart monitor, that can also be used to assess fetal well-being. And moms, I'm sure you are probably familiar with the electronic fetal heart monitor. When you're in the hospital, they put the thing around your belly and you got you hooked up, and monitors, and that is the electronic fetal heart monitor. And that device can be used for fetal well-being, looking at the baby's heart rate, deceleration or acceleration patterns, variability, mom's contraction patterns. All of those things can be used in the electronic fetal heart monitor. In addition to that, fetal well-being can also be assessed through a blood or umbilical cord blood analysis. That can also help doctors be able to determine fetal well-being. So the purpose of this quick video tonight is to help you understand that it's not that when you are going through this process that there are no tools that doctors and nurses can use to be able to help understand fetal well-being. There are tools that can be used, and these tools can be very helpful when we are talking about this concept. If you have more questions, maybe you are here watching this video today because your baby has suffered an HIE, or hypoxic ischemic encephalopathy diagnosis, or maybe you have a subsequent CP or cerebral palsy diagnosis and you have questions. If you have that going on, there's a telephone number on the screen. What I invite you to do is to go ahead and pick up the phone and call me. I talk with families like yours all the time about these issues. This is what we do. When you call my office, just let them know that you would like to get on the calendar and either speak to myself or my co-counsel, Renee Boston, about this. And remember, it costs you absolutely nothing to talk with us about your baby story. One more thing before I go. I want to make sure that you understand, because this video is on the internet and on social media, I want to make sure that you understand I practice law here in the state of Maryland. And if you are not in Maryland, because it's on the internet and all of that, you just got to understand that if this is something that we think we can assist you with, that we have to use what we call co-counsel or local counsel. In other words, an attorney in your state. And that's something we can work with you on, but I just want to make sure that you understand that co-counsel or that local counsel aspect of things. All right, that's going to be it for tonight's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here in the state of Maryland at Boston Law Group, LLC. We'll talk with you next time. Take care and enjoy your evening.